COVID has given us an opportunity to reflect on how services have been delivered in the past and what's needed for change. And it's clear that a new direction for health and care in MS is a pressing need, and that requires effective leadership. Barb, what does that mean?
Great question, Gabe. When we think about leaders, we tend to think about someone who is at a very prominent level. We think about the leader who is going to lead us, create the teams or the coalitions to keep us moving forward. And what we know now in leadership is that leadership happens at all levels, and it happens in a lot of different ways and at different locations. What we need to do is shift our perspective from having that single leader to actually building a ship of leaders who can work together, both co-located to create a sustainable future, but also in their own trusts, in their own regions to build leadership. So Gabe, talk a little bit about the leadership program from the MS Academy and how that was implemented.
Thanks, Barb. So the leadership program with the MS Academy took into account the complexity of the NHS and the diversity of the people that are critical in ensuring that we deliver high quality care in people with MS. And that really includes everyone in that chain: consultant neurologists, nurse specialists, pharmacists, administrators, and managers. So the program was set out to bring all of these people together, people who had a disposition to lead, to really nurture their leadership skills and help them develop to better understand each other, their perspectives about the needs in the NHS, to ensure that they're able to come about and understand what is a vision, how to align people around them to build a strategic direction to really make effective change. Yeah. But what would you say in terms of the curriculum, Barb, that the leaders are learning when they take on that program? And how would this impact the overall goal of changing the NHS?
Yeah, so we know that leaders develop in different ways. And we always begin with the fundamental of leading self. Who you are as a leader, the strengths you bring, the perspectives that you bring to your leadership is actually what enables your leadership, but it also is what enables you to create engagement, followership, if you will. People have a tendency to follow people that they know and people that they trust. So we focus on leading self as the foundation, but then we also talk about leading others, how to have effective conversations, how to tackle tough conversations and manage conflict. And then we talk about leading in the NHS. We talk about things like, how do you understand the NHS system and where are the key leverage points to begin to create change? And when we've got that momentum built, how do we think about leading the change? And again, as I said, enrolling others to be part of the change, engaging others to actually be able to inspire them to lead as well. So when we think about that, I like to look at the work of this last leadership group and the vision that they inspired by working together. As part of the program for the delegates of the Leadership Academy, we asked them to take on a group project, which was wrestling with a thorny issue in the field of MS. Gabe, can you tell us a little bit more about that project and what the results have been?
Focused on a question, which was what bold measures can the NHS take to reduce emergency admissions in people with MS? And through a shared leadership model, the participants of the leadership program came together and developed something that was much bigger than addressing just the question at hand. And they realized it was critical to leave not one MS patient behind. They presented this project work at the Raising the Bar meeting recently. And not only were they inspired together, but as the power of leadership, they are inspiring others to work with them. And in fact, there was a call to see whether or not there'd be interest to have others engage in this important project work. And in fact, we've got people now from Europe, North America, Africa, who are coming together, united to build something bigger and better for the future of MS. This is about coming together, building leaders, ensuring that not only can they change MS services, but more broadly, the NHS at its core.
Such a great way to think about the idea that leadership can be practiced by anyone, and being intentional is really what can create the change that we need to see.
And
Thanks.
despite the NHS being complex, multi-layered, sometimes difficult to navigate, coming together, building a vision, a strategic direction, aligning others with them, they can influence for the common good and make effective and long-lasting change.